I'm very much more of a left brain person, so art sometimes for me is challenging because it's like, oh, what is this saying? And it like challenges my right brain to really think abstract. So I do, I like art. I'm Sheryl Bicovny. I'm a speech therapist for CompHealth. I like to work with the adult and geriatrics. I do like neurology. I like the stroke patients a lot, and I also like traumatic brain injury as well. I just like the challenge of it, especially with those individuals who have had head injuries. Sometimes you just don't know where they're going to go, depending on, there's different scales. There's a Rancho-Slow Amigo scale, and if they're like a Ranchos level 4, a lot of times, their attention is something that you're really working on to try to get them to really focus on what you're doing, and that's maybe a goal for that type of patient, and then you kind of see them emerging. There's so many different paths that a speech pathologist can really explore. Like when I was in Wyoming, one of the therapists was trained in DPNS, and I wasn't even aware of that. And by traveling, that really helped me to just understand different ways of treatment. She also was trained in eStim, which really then kind of sparked my interest. I've been traveling now for a little over 2 years. Being out in Hawaii, I learned how to surf. When I was in Wyoming, I did some camping and hiking, out in Colorado hiking. In Boston, I was able to see some shows out there. Just being in a city life, and that's what I really took advantage of there. Just having a good relationship with your recruiter makes all the difference. My recruiter has been wonderful, and pretty much what we do is we go down the list of sites that are available, and I really enjoy the hospital setting, so we'll go down the list and see what hospitals are available. Corey Bonsheim is my housing coordinator, and I've had awesome housing assignments. What is most important, like CompHealth offers so many of these other things, and salary is definitely comparable. My recruiter, like I said, she's been great to work with and just really follows up with how I'm liking assignments, and I just feel very comfortable. I have a lot of trust. And CompHealth has really helped me to grow professionally, socially, just in all areas of my life, and I will continue to travel with this company because it's just been a very positive experience. There was a young guy that I was working with when I had been in Maryland, and it was in shock trauma. He had gotten a tracheostomy done, so he had a trach here placed. I tried putting on a speaking valve, which is it's called a Passimir speaking valve. It's a one-way valve, and you would just place it right on the trach. This patient hadn't been speaking. His mom was coming in to see him, and to get these patients back where family members don't always know what the options are and what we're doing. When I had gotten him talking, just her hearing him talk, and she got tears in her eyes. I just really got attached to them.